The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor.
Welcome to LymphCast, the gathering place for physicians, healthcare experts, and special guests. We dive into the world of lymphedema, venous disease, and other related disorders, exploring their impact on your daily life. So settle in, unwind, and join us as we uncover everything you need to know about lymphedema and related conditions on our engaging show LymphCast.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Well, greetings and welcome to the LymphCast show, episode 43 tonight. We are glad that you are with us. If you are listening on the podcast page, remember every episode is on YouTube. Just go to YouTube, the show, you'll find it. And if you're on YouTube, yes, every show is in podcast land, Apple Podcast, pretty much wherever you get podcast, you will find us. I also want to direct you to our website, lymphcastnetwork.com, and everything is there that you need to know about this show, including our email address. Lots of people have lots of questions for doctors. Well, here's your chance. You can send one in and we'll give it to the doctors to answer on a future show. hello@lymphcastnetwork.com. Well, let's begin tonight's show by meeting our panel from New York, RVT, Jacqueline Sasek. Hello, Jacqueline. How are you?
I'm well. How are you?
Not bad at all. Glad to have you here. Let's head out to California and meet a regular panelist, Dr. Emily Eicher. Hello, Doctor.
Hi, Paul. Hi, team. Thank you so very much and welcome, Linda-Anne, one of our pioneers in the field of lymphology and lipedema associations. And today is a special day. It's the World Lymphedema Day, March 6th. So we congratulate to all of you who are contributing to this very special day in special attention to Linda-Anne and all the lymphology and lipid disorders.
And let's meet the founder of this show. He's also the founder and owner of VitaSupport. They make Vein Formula 1000, Lymphatic Formula 1000 from New Jersey, physician Dr. John Chubak. Hello, Dr. Chubak. How are you?
Hi, Paul. I'm doing well. Thanks very much. I'm looking forward to tonight's show.
We've had a very lively discussion pre-show, so let's get into the liven it up once again. I'll turn it back to Dr. Emily Eicher, if you'd be so kind to bring our guest in, and we'll get the show going.
Hi, everybody, and it is great honor to welcome our wonderful Linda-Anne Kahn. She's one of the pioneers in the United States and elsewhere, internationally as well, in the field of lymphology, lymphatic disorders, lymphedema treatments, lipedema disorders, lipedema treatments, in addition to aromatherapy. She is the pioneer in aromatherapy, contributing to all the lymphatic disorders. So it is great honor to welcome Linda-Anne Kahn. Linda, thank you for joining us.
Thank you so much. It really is such an honor to be here on the show, and I look forward to talking to you all.
So we go back when to when, and I don't want to start counting the years, but it has been quite a few years. We initially met at the National Lymphedema Network meetings, and it was a few decades ago.
Just a few.
And Linda truly is one of the exceptional therapists and pioneer in the field of lymphedema management and treatments, combining with lipedema problems as well as aromatherapy. So I'll just ask you, Linda-Anne, dear, how did you come up with this type of work? What triggered your interest in the field of lymphology? And when did you establish your clinic?
Well, isn't it crazy how we get led to our passion and what becomes our life purpose? Because that's really what happened to me. I actually started off as a beauty therapist. I married my husband, David, also many, many years ago. And we owned a pharmacy. And so I went to school to study skincare and beauty therapy. And I was always interested in the lymph system. Since the time I was in school, when we studied just about nothing, on the lymph system. But when I came to this country, to the United States, we arrived here in 1980, I got a skincare magazine and opened the skincare magazine, and it said Dr. Vada's Manual Lymph Drainage. And so I went to Salt Lake City in 1983 to study with a woman from Finland, Dr. Vada's Manual Lymph Drainage. And I don't know, it just happened. It was just there. I called them up and said, I want to come. And the rest is history. Of course, after that, I trained at the Dr. Vada School. But it very clearly soon became my path. And then I opened the clinic in 1982 with $2,000 and a husband who wanted to go back to South Africa. We expanded many, many times. At that time, it was just me. We've expanded, we've lost space and expanded. Today, we have about 18 people on staff, and it's a day spa and a wellness center. And we have a we do a lot of lymphatic work, pre and post-surgical care. We have acupuncture, naturopathic medicine. And so it's a huge, it's a whole clinic.
Linda, this is an amazing story. And there's something I want to touch on. It's a little bit off subject right away, but we're going to come back to the subject. This idea that you saw this advertisement in the magazine, and for whatever reason it resonated with you, and you responded to it, and you went to Salt Lake City, and you got this training, and it changed the whole direction of your life. I think it's something that we can all probably resonate. And I know Paul's story a bit, and I know Emily's story quite a bit, and I know Jackie's story. For myself, it was very interesting. I had spent my whole life from the age of 5 really being groomed by my father to become an open heart surgeon. And I was an open heart surgeon, a very successful one here in northern New Jersey. And one day a postcard came to my office, no bigger than this, in the mail about laser treatment for varicose vein disease. And with all the mail that comes through the office, and you throw these cards out every day, one after the other, somehow I saw that card and I picked up my phone in the intercom and I asked my assistant, please, register for me this course in New York. And I went to that course and it changed my whole life. And I know Jackie, many years ago, Jackie, I've known at least 15 years now, she had her own mobile vascular ultrasonography business. And she put a bunch of, I don't know how many hundreds of cards in the mail. And I think very few people responded, but I happened to be one of them. And I hired her, and she worked for me for so many years, and now we're the best of friends. And that card changed her life, my life, right, Jackie? And
that was a postcard as well that went out.
Right, a postcard. Yeah. So 2 postcards changed my life. But it's amazing. Before we go further, Linda, do you have any thoughts? Because I know you're quite a kind of spiritual person also. Maybe this is not a medical, more a metaphysical question. Why do you think things like that happen? Do you have any idea? Do you have any thoughts on that?
It's synchronicity. Everything is meant to happen the way it's meant to happen. If you listen for the signs, you'll be led where you need to be.
And Emily, beautiful. Emily was training to be a surgeon in New York after having gone through so much hardship to get through medical school and get to the United States and to become a surgeon, and then had her lymphoma, which led to her operation, which led to her disability, which led to her calling in lymphatic disease and lymphology, and now being a world-renowned expert on the subject. What do you think, Emily? Do you think that was an accident?
I think it was predestined to be. And today I would say the plan A was to be a surgeon, and I was really pounding my head against the wall. I really liked to cut and close and explore. And I had good dexterity. I was a seamstress before, so it was fun to stitch on the living tissue, but it was not meant to be. And my medical condition led me to select the plan B. And today I say I'm grateful to plan B, because the gratitude that I get from my patients today, I would never get from the patients that I would operate on. And it's incredible. Not too long ago, I had head of a surgery from UCLA, and I used to go to ground rounds with them. And he said, Emily, that thing that you do for my legs, it really helps. I feel so much better, and it works. So it's wonderful to understand the lymphatic system, how it works, and what we can do conservatively, and if not conservatively, then surgically, to improve the condition of the lymphatic system. So again, I would say plan B. I didn't think about it before, but today I embrace plan B, and I'm very grateful. It's not fun to live with lymphedema in my leg, but I am capable, and here I am.
And we're all grateful that you are doing the work that you do. I enjoy referring patients to you very, very much.
Absolutely. And we also appreciate her role here as an educator, not only to other physicians and clinicians and therapists and so forth, but to raise awareness to the patients who are suffering and who need help and always need to know that there's hope. And that's where I want to bring that little discussion full circle, to know that hopefully someone has just tuned in here today for the first time, and maybe by accident, they found our show, they found our YouTube site, they found our podcast. And hopefully, just like those postcards were for me and the advertisement was for Linda-Anne, and the disease turned out to be in some ways a blessing for Emily and led her on a new path. Hopefully someone just found this show by accident. Hopefully it's going to be exactly what they've been looking for, because I do believe that whatever you're in search of is also in search of you, whether you found each other or not yet. Linda-Anne, let's go back to you, because I find it so fascinating. Tell us a little bit, please, about aromatherapy and how you became involved and what role it plays in the work you do, and just give us an education.
Okay, but there's one other synchronicity that I do want to let you know about.
Please.
Was that I did not know that I had lipedema when I was drawn to this.
Fascinating.
And when I graduated at the Dr. Vada School in 1992, my instructor, Hildegard Wittinger, said to me, "Oh, you have lipedema." And I said to her, "But I don't look like all the pictures you've been showing us of the big ladies with the heavy legs." So I knew there was something wrong with me, but I had no idea that I had lipedema. So I got led to this, so that now I can really, really help my patients with heart and soul and complete understanding.
Beautiful. What a remarkable thing. And we're finding that. I think we've found that quite a bit on the show, that many people who got involved in the field later found that they had some degree of either lipedema, lymphedema, phlebolymphedema, lipolymphedema, etc. And it just goes to show how many people are going around undiagnosed or misdiagnosed. So it comes as no surprise that happened to you, but it is, again, synchronicity.
So the aromatherapy, you want to ask the question?
Please.
Well, I discovered, I was here in the States, I'd opened my clinic, and I discovered a book, The Art of Aromatherapy, by a man called Robert Tisserand, who's a very, very famous researcher. He was in England at the time, and I was fascinated. And the book detailed so many things. It spoke about Chinese medicine, reflexology, aromatherapy, massage. So I decided that I was going to do everything in that book. And I did, and I trained with a woman called Eve Taylor of London. And since then, I've studied with many, many other practitioners, including doctors, aromatic medicine, and I also teach. So that also grew, and it was actually difficult because as the conferences, the National Lymphedema Network would have a conference every other year, And the new aromatherapy associations would have a conference every other year as well. And they were always on the same weekend or a weekend apart, and I couldn't take off. And my heart really was in aromatherapy. Everything I was doing was for that. But I found I kept on choosing the lymphatic conferences instead. And so I use oils all the time. In my clinic, I own an aromatherapy day spa, and they play a really important role in the treatment of lymphedema and lipedema, not only from a physiological point of view, but also from an emotional, psychological point of view. Because as you know, there's a lot of anguish and anxiety and fear and that goes with these diseases. And so you can use essential oils to calm the nerves. Because you want me to educate you a little bit, right? So as we inhale an essential oil, it goes directly through the into the olfactory nerve. We have cilia in the nose, and there are receptors on the cilia for each aroma. And then from there, it goes to the olfactory nerve directly to the limbic system of the brain, where it will trigger thoughts, feelings, memories, and emotions. And this research is showing that within 5 minutes of inhaling the oil, it's in your brain. So we can make tremendous changes. So that's the psychological effects of the essential oils. And then there is the physical. As we massage the oils on, and the medical doctors in France do internal use of the oils, as we do that, it goes into the system, even from massaging, and will help physiological. So it will help lymphatic flow, will help muscle spasms, help you with sleep, many, many other factors.
This is remarkable. Jackie, don't you love being on this program? Jacqueline Sasek, you do, right?
Very much, yes, very much.
This is incredible. Now, Emily, have you incorporated the use of any of these essential oils or aromatherapy into your practice?
Yes, I do. Yes, I do. And even though I was trained by Professor Leduc, one of the European authorities pioneers in lymphology, he advocated to do manual lymph drainage treatment just without any oils, or just on bare hands on a tissue of the patient. I incorporated castor oil. Castor oil is bacteriostatic, and also it's little viscous. So when and many times I massage patients as well, which probably I'm one of the very few physicians who is administering the manual lymph drainage treatment to the patient. With castor oil, because of the viscosity of the oil, I have a better traction and the pumping action of the lymphatic aspiration in stagnating lymphatic segment of the tissue. And so I use that. And also I use aromatherapy for myself and my kids to wake them up in the morning. And by inhaling certain type of aromatherapy and massaging on the temple of the patient, my children, I do see remarkable changes. And so even though aromatherapy is not explored deeply, there are some benefits to aromatherapy. So indeed, I apply this in my practice as well.
So I'm on a research committee for our national association, the Alliance of International Aromatherapists. And we have a database of research. And the research studies are not double-blind, they're not 300, 500 studies. So we have to get more studies, and many of them are done on animals. But the research is increasing all the time with the efficacy of the essential oils. So that's really very exciting.
That's very interesting. Can I say one other thing? And I'd love to get Linda-Anne's thought on this, because I'm betting that she has some information or knowledge here. I remember many years ago when I was active in open heart surgery, Dr. Mehmet Oz, who is well known to many people because of his tremendous exposure, his television show, and so on and so forth. When he was doing open heart surgery, it must have been in the early 2000s, I believe, he was not using aromatherapy, but he was using audiotherapy during open heart surgery on the patients. He was putting headphones on the patients. And forgive me if I'm wrong about this, but this is my understanding. I can't swear on this. In terms of, I don't know what he was using, what kind of waves or tones and so forth, even under general anesthesia for relaxation of the patient, hoping to elicit better surgical outcomes. So the senses, smell, sight, taste, touch, and so forth, hearing, they are so intimately related to the limbic system and the emotional mind and our feelings. And we know that there's a strong psychosomatic response. And when I say psychosomatic, I don't mean false in the sense of psychosomatic. I mean psyche, the mind, and soma, the body, being interconnected. The same way we know, and Emily knows very well from our old days in surgery before proton pump inhibitors and H2 blockers and so on and so forth, that stress, emotional and psychological stress, was eating holes in people's stomach and giving them perforated gastric ulcer. So we know that there's a very real connection. That's one of a million examples, but a very real connection between the psyche and the physical body. So if aroma could affect it, it's very interesting to think how sound could affect it. And Emily and Linda-Anne both comment on this. I've never had this thought before, and I think that's why the show is so fantastic. I think I learned more than anybody who's a guest or listening. When you talk about MLD, for example, of course, we know that there's a physical component in terms of the lymphangion and moving lymphatic tissue, et cetera. But I wonder how much of the healing process may be associated simply with touch, the human touch and the emotional response to being cared for and someone caring about you. Do you have any thoughts on that, Emily?
Absolutely. Quite frequently, I have, excuse my expression, cranky old men coming with phlebo lymphedema. And after doing manual lymph drainage, they felt like, well, this was very healing. And the patient is calmed. And once the patient is receptive to accept what we are offering to the patient as a part of the conservative management, the treatment, the patients do get better if they're open-minded. And going back to aromatherapy, there was an article about this wonderful 93-year-old neurosurgeon. And I forgot, I think she's still active in Switzerland somewhere. And she gave a talk about herself. When she was a youngster, she didn't do well in the school. And somehow her mother came to aromatherapy and she was giving her patua, inhaling and also massaging her temples. Well, the young lady ended up on the top of her medical school, and even at the advanced age, she is still doing ground runs with youngsters and teaching them in a neurosurgery. So, which is really amazing. So there are some tremendous benefits to aromatherapy in combination to scientific studies.
Yeah, and Linda-Anne, I'm going to ask a question that I think is probably rhetorical at this point. In your center, I would imagine that you're using a combination of touch, aroma, and auditory stimuli, music, and so forth.
Yeah, I have specialized music that I use, and then I will custom blend an essential oil blend for my client, which I do. I do custom blends for people, but when I'm doing a treatment, as soon as I see them, I look how they're walking down the hallway, and then I'm already getting tuned into what's going on before we've even done the intake or the update as to what's going on with them. And then I custom blend an essential oil blend, and then I will use that during the treatment. I do manual lymph drainage, we have music, and I combine sometimes infrared light or cupping or other modalities that I need to do. And then I will have them inhale the oil first, and then I'll use the oil blend on them. Then I give the oil when I'm doing the lymph massage. I'll give that to them to take home. We give it a name. I tell them where to apply it in their body, their specific areas. And that in itself is healing. Because as you are putting something on them and you are telling yourself, heal or release, you are going to be feeling that in your body. Because yes, there is so much more than just the manual lymph drainage. There's the healing touch, there's the energy. So we therapists and practitioners have to keep ourselves very, very grounded and healed ourselves, because that's all going through to our clients. And that actually is very healing to us, right? Because we have to show up and we be strong no matter what's going on. And we can do that. So lately I had a big loss in my family. So the oils that I used on my first clients on the day that I got back were actually for me. And I also have a diffuser that I have in the room. And so they can be used for so many things. And back to what you said about Med Oz, doing the music for the patients. I remember reading many years ago about healing touch being done on patients before they had heart surgery, and that those patients fared much better and healed much faster than patients who had not had that. So all of these modalities, these integrative body-mind, energy medicine, as well as our medical treatments that we're doing, play a huge role. And then the manual lymph drainage itself, it has a sympathetolytic effect. So it calms the sympathetic nervous system and brings up parasympathetic. And that in of itself is very, very healing.
I'm going to bring Jackie Sasek out of semi-retirement. We're going to open one of these centers right here in my office.
I'm in.
Right? These patients, yeah. I have so many patients who would benefit from this kind of therapy. Yeah. And there's nowhere in our area that's providing this, I'm sure.
I had a patient ask me the other day, she was a lipedema patient and she's traveled an hour and a half to see me. And she said to me, what you're doing is unbelievable, how you're integrating everything. Are there other people who work like you? And I said, there are very, very wonderful therapists and highly trained, but there are not many people who integrate as many modalities as I do. And I wasn't being vain, it's just true. So, but
Agreed. We've had many therapists on the show, and I would agree. I want to come and visit your center, Linda-Anne, and I want to come and visit Emily's center. That's long overdue, for sure. For sure.
Have Linda, you ever been? I'm sorry.
Oh, go ahead, Jackie, please.
I was just curious, do you also...
Vein Formula 1000 and Lymphatic Formula 1000 from Vita Support MD are backed by science and sold in doctor's offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
Integrate like nutritional diets or...
I do. I'm a health coach. I'm a health coach as well. And so I do help and guide my patients with the correct eating plans. I lecture on that too, and help them with that. And then I coach them, because it's not easy, as you know, Emily, for people to just make changes. You can't cut everything out. So every week they're coming, or whenever they're coming, or I'll send little text, I'm coaching them and helping them along the way. So...
That's fabulous. As I recall, Linda-Anne, I think you were a co-author with Emily on the nutritional guide. Isn't that correct?
Correct.
Yeah.
Correct.
And in fact, it was that book that, of course, I was already very much into micronized purified flavonoid fraction, but it was in that book that I really sort of got an education. And then we did further research based on the references and so forth on the power of selenium and the power of vitamin D3 in supporting the lymphatic system and so on. So
and then you sent me, you had just formulated lymphatic formula, and you sent me some with the micronized bioflavonoids,
yeah.
Spiridon, and I've been using it ever since for my patients and for myself. It really is the most incredible formula. you've got everything in there.
Thank you. You just reminded me of that. That was years ago. I had forgotten about that, Linda. And I think that may be how we first met, in fact. I don't know. But that's a time ago.
Yeah, it really is. And then going back to all the energy and the nervous system, and you spoke about the limbic system, the vagus nerve is really important as well for patients, because we have to look at a person on all levels, body, mind, and spirit, if we want them to heal. And so the vagus nerve is really important. And when we do deep breathing and we bring the aromatherapy into it, we can actually help to trigger that vagus nerve and help to calm the autonomic nervous system and really help the patient on all levels.
Well, it's fascinating you should mention that. I'm sure Emily is thinking exactly what I'm thinking. The example I gave earlier of the peptic ulcer disease and so forth, prior to H2 blockers and prior to Prilosec and these things, the surgical procedure, in addition to repairing the hole in the stomach if the hole were completely erosive, but the treatment of gastric ulcer was surgical vagotomy. We did partial vagotomy, truncal vagotomy, selective vagotomy, super selective vagotomy, but it was all about treatment of the vagus nerve. You remember that, right, Emily?
Of course. And how many patients we had after major surgeries with bleeding ulcers. And that was early 80s.
All stress-induced.
Right. But going back to Linda-Anne, you mentioned that you are living and dealing with lipedema on a daily basis. For our patients, perhaps you can tell us a little bit about lipedema and the difference, lipedema, lymphedema, obesity, and how they differ.
Sure. Well, lymphedema is an abnormal accumulation of fluids in a tissue, in a limb. Usually it's a limb, an arm, or a leg. I know you know this, and can be the face after certain surgeries as well. And it's very different to lipedema, because in lymphedema, it's usually one limb, whereas with lipedema, it is a connective tissue disease. We used to call it painful fat, but the fat is loose connective tissue, so it's a connective tissue disease, and it's bilateral. So usually, and it's mostly in females. It's an estrogenic disease. There's more and more research coming out to show that the estrogen is playing a role in that. And in lymphedema, there is no pain to speak of, not real pain. And with lipedema, there can be really terrible pain throughout the tissue and fatty lipomas. In lymphedema, the feet are involved, and they can be very edematous, and the arms, the hands. In lipedema, the hands and the feet are not affected unless it is lipolymphedema, where it is lipedema that has progressed to lymphedema as well. So they are two separate diseases, although we know that there is lymphatic dysfunction in lipedema. And the research is showing more and more the estrogenic component to the fatty tissue in lipedema. And I could go on, but I think that's answering the question, right?
Thank you so very much. You mentioned that lymphedema is painless, and I respectfully differ
because I said sort of.
Unlike you have lipedema and I have lymphedema, so we are a fantastic pair. But I have involvement of one right lower extremity. And yes, at the end of the day, it's heaviness and tension and pressure. And similarly to lipedema, standing on one spot for a long period of time, more than 20 minutes or so, you start feeling more discomfort. And it's achiness, not a sharp pain, unless there is some other pathology included. In lipedema, it's also heaviness and it's tension and pressure. And when you compare the tissue consistency of lymphedema, it's more firm. Lipedema is nice. I like to say it's very feminine, squishy, fluffy, and painful to touch. And especially on certain parts of lower extremity, on the medial aspect of the knees, if you touch the patient, and you are not careful, they can jump from the pain. It is not welcoming.
And there are different stages of lipedema. So I have stage 1, and it is a progressive disease. There's stage 1, stage 2, stage 3, and then lipolymphedema. My condition did not progress, and I really believe it's because of all the conservative methods that I've been doing for the past 40 years before I even knew that I had lipedema. So lipedema fat is usually not responsive to diet and exercise alone. However, I have led a lifestyle that has really, now we don't know, there are different genes and we're finding out more about the genes, but I really believe that the way that I've lived my life has stopped the progression of this disease. And I'm very, very grateful for that. And when I see patients who are already in stage 3, and I know Emily works with a lot of lipedema patients too, it's much harder to treat than if I have someone in stage 1 and we can try to help prevent the disease from progressing. And then Emily and I in a group together, and we've been talking about speaking to the youth and the adolescents so that we can actually see what's happening ahead of time and really help these young women from developing into this disease. Emily's doing a lot of ultrasound. She actually can diagnose, no, that's not the right word. You can identify lipedema at an early age, right? Correct, in the tissue.
That's correct. And by all means, even though they say, or the literature points out that the lipedema is a progressive disease, I would say it's progressive if you are not diagnosed early and if you are not treating lipedema early. And what is the treatment? It's significant diet, exercises, combined compression, and so on. The lifestyle is completely different. It changes with lipedema. But with the ultrasound, I can confirm the actual diagnosis of lipedema. And not that long ago, I had a woman in her 60s. She had no clue she had lipedema, but she was stage 1 lipedema, mild, but it was there. And why? Because she also has a wellness center, and all her life, she ate very healthy and exercised minimum 3 hours a day. So she maintained her status. And then you have patients who are much younger than she and not knowing they had lipedema and ate all this inappropriate food and fatty food and so on, and never exercised, never walked, and they were sedentary lifestyle. And they progressed from stage 1 up to stage 3, not knowing what was happening to their body.
Yes, and I have a patient who is now, she's 79 now, and she's 82. She came to me when she was about 76, and I helped to identify that she had lipedema. She's from Germany originally, and she would swim, they would eat a healthy diet, they had no additives, they would always be walking everywhere, and so her lifestyle was really good, and she knew she had heavy legs, so she continued when she came to this country, still eating clean, swimming every day. And so her lipedema is only stage 1. So I totally agree with you, Emily, that the lifestyle is what can do that. And also we have all these ultra-processed foods here, and the chemicals in the foods that is definitely contributing to inflammation, because this is an inflammatory condition. So we really need to look at everything that is causing inflammation.
What are some of the symptoms? Oh, I'm sorry. What are some of the symptoms that someone should look for to,
first of all, this is not always this way, but the classic look to lipedema is smaller on the top and larger on the bottom. Legs that look like tree trunks sometimes, or have a little pad around the ankle on the medial aspect, around the knee on the medial aspect of the knee, pain, hypermobility, but most people don't really know what hypermobility is, but they'll often have knee problems, joint problems have come out, easy bruising, and then there can be headaches that occur as well, digestive issues. Those are some of the main ones. But there are different types of lipedema, so they're not all, the body isn't all that way, but that's the classic lipedema.
Right. But the tissue consistency, when you touch lipedema, it's kind of welcoming. It's very soft. It's a little fluffy. And normal tissue, controlled or lymphedema tissue, is much firmer. So there is one distinguished point. Also, we didn't talk much about the children in lipedema. And just a few days ago, I had a patient and she was so happy because, yes, I diagnosed her with lipedema stage 2. She didn't know and that she had lipedema, but she was so happy because her 16-year-old daughter is a gymnast. And I asked her to show me a picture of her in the gym outfit. And it was clear lipedema. And there is even though, like I tell patients, I've seen so many patients with lipedema throughout my career of 30 years of lymphology, there is not one identical to the other. However, lipedema has a specific shape of fullness of the legs. Like the patient told me, in the high school, they called me thunder thighs. And poor thing, she didn't know she had lipedema. She was just enlarged, and she thought it was the ethnic background, and this is what everybody looked like in her family background. Therefore, she thought it was genetic. However, it's important to diagnose kids early. And when I look at the little gymnasts, when they have little fullness in the legs and the knees are kind of buried, and they have hypermobility, so they can be so very flexible. And the butt is a little bit fuller. You want to examine them to see, do they have lipedema gene? Because it carries from the grandmother, usually to mother, to the daughter, and so on. And if it is from the paternal side DNA, then father can be a carrier. And then the daughter can express the gene and become full-blown lipedema. So it's important to not look only at adult patients, but the children. And the older literature say, yeah, lipedema is a diagnosis of larger women in their 30s. It's not true. I don't want to say I can diagnose, but yes, by clinical examination and confirmation of the ultrasound findings, you can see it in children as well.
How about men, Emily? Would you say that there are any men affected by lipedema?
In my practice of 30 years, I had 2. Yes, yes. Usually they have low testosterone, and the expression is not exactly the same as in women, but they have a symmetrical fullness of lower extremity.
Yeah, because there are some men that you see who have, I would describe, again, medically as a more kind of estrogenic shape, especially with obesity. And I wonder now, as I'm more and more versed in this subject, if some of these men that I have seen over the years may have had an expression of lipedema. As you say, you can see just phenotypically in their, in their appearance that they are probably low testosterone and more estrogenic, but they do take on that characteristic shape of a bigger bottom, a more feminine kind of shape to the buttocks and the thighs and so forth, and smaller on top. So I feel like it may be an area of greater awareness that maybe we're under recognizing.
Well, lipedema is under-recognized, undiagnosed, misdiagnosed, and dismissed by medical ignorance. A lot of physicians say, what do you mean you have pain? Go to see a pain specialist. It's in your head. You need to see a psychiatrist, etc., etc. But there are certain characteristics, and we should specify obesity versus lipedema. In obesity, the trunk is involved significantly, and it correlates with enlargement of the lower body as well. In lipedema, especially in early onset, in teenage years, when the hormonal influx is just surging, you have beautiful skinny waistline. And from the waist down, the hips are enlarged. It's nice pear shape, but the tissue consistency is very soft. And there are different characteristics with this.
And it usually is a woman's disease. In my practice of 35 years, I've also only had one man. And when I took pictures of him from the back, he looked just like a woman. I mean, it was the typical lipedema shape. He also had low testosterone. He had another disease as well. And he told me that he had been brought up in Slovakia, actually. Slovenia, not Slovakia. You're from Slovakia. Slovenia. And they were very, very poor. And they would go to the market and they would get leftover things, apples, they were rotting, and then cut off and have that. But anyway, his mother thought that he was stealing food because his siblings were all very thin, and he told me that age 10 he was already large. So it's unusual, and it is usually it's a hormonal disease. So usually hormonal changes will be when lipedema will manifest. But in this case, this gentleman had it from a very, very early age. And then, what Emily was saying, we go to the doctor, and the doctor just looks at the patients and says, you just need to lose weight. You need to lose weight, and then you'll be okay. You're not exercising enough. And so that's where the emotional aspects really, the patients say they get gaslit. The doctors gaslight them. They don't take them seriously. So we really have to educate physicians so much about this disease to help the patients. And the other thing we didn't talk about, and John, you're interested in the vascular system, that there is a vascular component to lipedema as well. So there's often spider veins and deeper veins, that are affected. And so the lymphatic formula that we use is helping with that as well.
We see it very commonly in my office, and Emily and I share pictures all the time and combinations of these things. Yep. Lipedema, phlebolymphedema, phlebolympholipedema. There's a lot of overlap, and a well-trained eye, and then with the vascular component, a well-trained ultrasonographer like Jacqueline or myself or Emily, it adds a lot. Emily, one thing that you touched on, which we touch on quite a bit on the show, but I don't think we've ever gone into a description, and I think that would be a helpful thing. Many of us are interested in this area. We've looked at the photos, the drawings and photographs of the so-called stages of lipedema, either Emily or Linda-Anne or both. How would you, other than those pictures, how would you describe stages 1, 2, 3, 4, verbally?
Linda-Anne, do you have pictures of the stage 1, 2, 3, 4?
I actually do have a picture. I'm just trying to see where it was. I actually was just printing it for a patient. I don't know where I put it here. No, I don't have that. But typically we see the stage, I think it's stage 3, Emily, which is from the waist down to the ankle.
Everything, right.
And then there's stage 4 is just the arms. I've only seen that in one person, just the arms. But typically we'll see those stages from the waist down to the ankle and then the arms. That's typically what we'll see. But sometimes you'll see a stage that's just from the waist down to the knees. And then the lower legs are not affected and they don't have that cuff. And I had a patient who was denied insurance for surgery, even though she'd appealed. And they finally said, no, you can't have surgery because you don't have lipedema because you don't have a cuff. Because she had type that was just from her waist to her knee. So, but I don't know, at the Lipedema World Alliance conference where I was in Germany, they were saying that they didn't really think there was any, it's just for us to know, but it wasn't really any significance to know the different types of lipedema. So
at VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At VitaSupport MD, we are passionate about making your good health our life's work.
Yeah.
In terms of the staging.
And that was a fantastic conference, the Lipedema World. We have a new Lipedema World Alliance Association that was formed. Emily and I are founding members of that. And that's going to be amazing, the research that's coming out. It was the most exciting conference. We had 500 people from 30 or 40 different countries represented there. It was in October of last year.
Well, maybe for the next show, we can show the stages, but even though the volume is not so expressed largely in stage 1, you may have the saddlebags. The lateral hips are involved, and it may go just to the knee level, and then from the knee down is it appears to be normal. However, the tissue consistency is not. And then you may have also abdominal area, I call it lipedema belly, slight enlargement. And as Linda-Anne pointed out, it's not only connective tissue disorder and vascular disorder, but a GI symptom is involved as well because of the leakage of the lymph from the lymphatic system, and it reacts to the diet. And this lipedema belly, patients are telling us, I eat certain foods and all of a sudden I get bloated, I have gas, I have constipation, I have diarrhea, which is part of it. And another component of lipedema is most of the patients have either endometriosis or polycystic ovarian syndrome, and so which correlates with lipedema. And all those aspects, they need to be encountered into the diagnosis and checked out and see if that can be improved.
And then many of them have mast cell activation disease. We're finding that more and more and more. And there has been some research showing the link between mast cell activation and lipedema. And the mast cells, as you know, are part of the immune system. And normally they activate and create histamine in response to a bee sting, say, and it's to protect the body, so you'll get swollen and red. But when there's mast cell activation disease, it's an inappropriate activation of the mast cells. And so the patients will get gut issues or hives or rashes or headaches or diarrhea, things like that. And it can be a terrible problem for the patients. And most of them don't even know they have that. So I always will ask questions when I'm doing my intake. First I do the clinical diagnosis and I palpate the whole area because I can find little nodules in the tissue, and the tissue can have fibrosis, it can have nodules, and it can have soft lipomas in it. And then I ask them, when you get out the shower, are you red? Do you sneeze a lot? Do you get rashes? If you scratch yourself, can you see it there still on your skin for a while? That's the
dermatographia.
Dermatographia. And then you start asking questions. I actually just referred a patient to somebody for mast cell activation. I cannot diagnose her, but I can tell her your symptoms are consistent with this, and this is what I want, who I want you to see. But as Emily knows, the tests are not accurate enough, unfortunately. And when you do the tests, you're supposed to really be having an outbreak, which doesn't normally happen. and then the tests have to be done, and the results have to be kept cold and sent to the laboratory within an hour and kept cold. And that usually doesn't happen. So it's very difficult to diagnose. But the patients, many of our patients have that as a comorbidity, is the mast cell activation. So it can be pretty miserable.
Right. I send a lot of patients, lipedema patients, unknown and firstly diagnosed lipedema patients, for allergy testing, for dietary allergy and also environmental. And a lot of lipedema patients are allergic or highly sensitive to strange foods. One patient that we know, mutual patient, she was highly sensitive to lettuce. Who would think of the lettuce? And another patient was saying, well, I cannot reduce weight and I am eating only healthy. I am eating spinach and chicken. And the allergy study showed that she was highly sensitive to both, to spinach and the chicken. So it's important to correlate the allergy study to see and then eliminate the highly sensitive foods from the diet.
And I agree with you with that. I send my patients now to have food sensitivity testing. There is a doctor who I follow who's in Brazil, who is a surgeon, and he's doing surgery, but
Amato? Yeah.
Dr. Amato. He's first doing 6 to 12 weeks of conservative treatment where he's identifying food sensitivities, cutting out the food sensitivities, having the patients do manual lymph drainage twice a week, swimming or swimming water classes twice a week, bioflavonoids, micronized bioflavonoids. He's doing horse chestnut, things like that. And he's then addressing the inflammation of the lipedema first for 6 weeks. He might keep them on that longer. After that, he puts them on a ketogenic diet. And then if they need it, he will do surgery. So he's doing all of these conservative measures. And he just came up with a study. I don't know if you saw it, Emily. I just got it this week, Dr. Amata, where they actually looked at surgery and saw that the conservative, it was 35% of the patients still needed conservative treatment after surgery. And I think that's very important because surgery is fantastic for the patients. It will reduce the pain and it will help mobility, but patients still need to monitor what they're eating and what they're doing.
Actually, 2 independent studies were done, one by Amato and one by Andrzej Suba from Poland, where they demonstrated with a diet, specific diet, and pretty much Mediterranean diet and low-calorie diet, they would improve almost from stage 3 to stage 2, including with exercise program and so on. So the diet is very, very important. But the key is to diagnose them first, because so many patients come and they are already in advanced stage and they have no clue that they have the lipedema. So we need to guide them and look at them globally, not only, well, you have this, you have just one component or so, everything, and address that.
And they also have tremendous pain. Well, Emily and I could go on and on forever about this, right? But they also have tremendous pain. And I'll be speaking at a conference in April, a fat disorder conference. I will be speaking and addressing the pain in lipedema patients and what to do about that, and the fascia, and incorporating aromatherapy and lymph massage and emotional pain as well.
We can have a talk, another one. Jackie, I wanted to ask you, when I do the ultrasound, I look at the fascia. In lipedema, the fascia is interrupted. And I coined it a long time ago, dancing fascia. But in more advanced stages, you see such a hyperechogenicity of the fascia. And sometimes the fascia is spread and the adipose tissue is impregnated in between the fascia. And it's so bright, which correlates with inflammatory changes. I don't know if you are familiar with ultrasound of the lipedema patients, and if you focused on the fascia, how different it is in comparison to normal control or obese or lymphedema?
Oh, Emily, unfortunately, I haven't really focused on the lipedema in ultrasound, to be honest. That's why I was
maybe we should
always saying to you for a class, that would be, there's so many, because I really feel that we're the sonographers are the first line for people, that how many times am I in the ER and they send the same patient over and over again, who's in pain, but it's not a DVT. But if we could do the ultrasound and see what the fascia looks like, I think then we could say, rule out lipedema, go see a specialist for this based on that. So I think a class on that would be amazing for sonographers to learn exactly that.
I couldn't agree more. And, Jackie, when she was working with me, Emily, we weren't focused. This was some years ago. It's been before COVID that she's been clinically active with me. We were, of course, focused heavily on venous insufficiency, rule out DVTs, venous insufficiency, and so on and so forth, post-therapeutic studies. We weren't having this conversation with you at that time about lipedema. Of course, we were looking at lymphedema patients, and we see the so-called ant farm appearance of true edema in the tissues and things. But lipedema, this is groundbreaking stuff that you're talking about, and I think it needs greater investigation and then obviously greater education. Because as Linda-Anne said, she can't diagnose and neither can Jackie, but certainly they can say your findings seem to be consistent with, and I think you should see this or that. Or in the case of an ultrasonographer, speak to the attending physician and say, these are my findings. You may want to consider this or that, or have this patient referred for this or that. So this is a fascinating subject. And it brings us around to a conversation that we have almost each and every show that Emily was just touching on, which is Linda-Anne's presence here today has been absolutely fantastic. And as she said, we can all talk about this. Certainly Emily and Linda-Anne can talk about this for hours and hours and hours. And that's the whole point of the show, is to have a discussion and to share information and ask questions and answer questions and move the conversation forward and move the field forward and move awareness and understanding forward. But the one thing that comes out again and again, and Linda-Anne has brought that front and center again, is that this is a holistic set of diseases that require holistic treatment. There is the psyche, there is the body, there are the emotions, there's the mind, there's surgery, there's diet, there's nutrition, there's exercise, there's movement, there's relaxation, hands-on therapy, compression therapy, aromatherapy, auditory therapy, visual therapy, light therapy, diagnostic testing, including physical examination, visually, palpation, light palpation, deep palpation, etc., good history and physical, ultrasonography. This is really, I think, revealing itself, this set of diseases and overlapping disorders, as one of the most fascinating areas of contemporary medicine and healthcare. It really is. The number of clinicians, therapists, etc., who have a role in the care of these patients is innumerable. And these patients, again, are being misdiagnosed, undiagnosed, underdiagnosed as the norm, not as the exception. As the norm, not as the exception. And that's why I'm so proud of this program, for raising awareness, keeping the conversation going, introducing ourselves to more and more great people like Linda-Anne Kahn and her amazing center. Linda-Anne, before we go, and we'll have you back for sure, because we just touched the surface, how can people get in touch with you? Where is your center, the name of your center, phone number, website, all of those great things, so people can get in touch with you? Because I always say there's help and there's hope, and Linda-Anne Kahn is an example of that. So please share with us.
Well, thank you. I'm on Instagram at Linda-Anne Kahn, Linda, A-N-N-E, Kahn, K-A-H-N. And then my day spa is Beauty Clinique. It's KLINIEK, beautyclinique.com. And then I have lymphatic therapy services.com, lymphatic therapy services with an S.com. And I'm also on LinkedIn, Linda-Anne Kahn.
Fantastic. Beautiful. Beautiful. Paul, I think that brings us full circle. If you want to take us out, my dear friend.
Yes, sir. Another terrific show. Lots of information out there. And remember to visit our website, lymphcastnetwork.com. Our email address is on there as well, which is hello@lymphcastnetwork.com. Every show is on YouTube, and every show is on the podcast platform of your choice. Apple Podcasts, TuneIn, Stitcher, Spotify, Amazon, you name it. We're out there. Just go there, like, subscribe, review, all that good stuff. And we appreciate you for being with us. Let's go around the room and thank our panel tonight. From New York, RVT, Jacqueline Sasek. Thank you, Jacqueline, for everything.
Oh, and thank you, Linda. It was wonderful. Thank you.
You bet. Also from California, Dr. Emily Eicher. Thank you, Dr. Eicher.
Thank you, Linda, and you are amazing. Thank you for sharing your knowledge with all of us. Thank you, Paul. Thank you, John.
Thank you very much. The founder of this show, also the founder of Vita Support MD. They make Vein Formula 1000, Lymphatic Formula 1000. Physician, surgeon from New Jersey, Dr. John A. Chubak. Thank you, Dr. Chubak, for everything.
Thank you, Paul. It was a great program as always. I keep learning, and hopefully we're sharing, and I'm helping to raise awareness with our incredible group. We missed our dear friend, Dr. Monica Glavitsky today. She's at the American Venous Forum and has been traveling. She was at the Mayo Clinic Wound Symposium just before that. So she's out doing her good work and, again, raising awareness in the medical community. Linda-Anne, thank you so much for being with us. We look forward to having you again.
Thank you so much. It was a pleasure and an honor.
Join us next time for episode 44 of LymphCast. Have a great day.